And as you know, the William Oslo Health System recently opened the Peel Memorial Urgent Care Center in the Peel Memorial Center for Integrated Health and Wellness. As we look the way, the best provide palliative care, can you speak about those facilities as alternative method to for our healthcare delivery? And also, can you elaborate for the home care visit how this model works?
Okay, so I'll start off with a home care visit. We work with with nurses, the CCACs, which are now part of the LINS because it's all at a provincial level. We are making a concerted effort to train as many nurses in that model as possible, going through the LEAP courses and the Pallium courses, which of course raises the standard that we should be measuring. You know, we should have outcome measures of how many nurses qualified through LEAP this past year, how many volunteers, how many physicians have managed to do the LEAP courses. So the nurse-doctor model is the most ideal model. I do think there is a role for nurse practitioners, specifically in areas where there is no physician. I do not think that nurse practitioners need to do this on their own, to take that responsibility, to actually behave like physicians. The job of a nurse and the job of a physician are not the same. So definitely the dyad is the best. In areas where you don't have a physician, then perhaps the nurse practitioner can take on the most responsible person for the patient. The Peel Memorial site is, of course, to get more patients to be able to get more care. There is one of the areas which we as the palliative care physicians will be involved in, and that's a nurse-led clinic looking at patients with chronic medical problems. And one of our goals over there is, if we think that ask the surprise question, which is a gold standard framework question, which is not ours, it's developed in the UK, which, by the way, are the highest country on the quality of death index, where the surprise question is asked when the patient comes into the emergency room. Would you be surprised if this patient would be alive within 1 year? If you would be surprised that the patient would be alive, he needs to have a goals of care discussion. If you're not able to do that, find somebody that can do that. Because perhaps what you think is good for the patient or the family don't really always think is good for the patient. So that's what I would suggest.
Time's up. Mr. Weber.